People's Pharmacy for all your pharmaceutical, skin, and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
And very special good evening to you. Let me apologize about last week. I was somewhere else, but welcome to this program this evening. This is Your Health Matters, and as I said, it's interactive. 457-9997. Ask me anything. We try and answer. You could also call on WhatsApp. Give us a WhatsApp text. Give us a WhatsApp call on the same number, 457-9997. We'll be certainly happy to entertain you, entertain your question. Last week, I was in Jamaica. I have never eaten so much ackee and saltfish in my life. Is that? And then the jerk chicken, and then I had oxtail. Oh my gosh. I was in Jamaican heaven. You know, and oh God, let me not tell you about it. Went to Kingstown, went up to Ocho Rios, came back, but Bob Marley's statue was nice, celebrating Bob Marley's birthday. And I had planned on last Wednesday to reach back down to the hotel to do a show from the hotel from a distance. I didn't get back in time. So let me apologize. But you know, a couple of persons have met me and said, Doc, what's the immune system all about? What's this about? What's the immune system? And I want to tell you, in your body, there are 12 systems. 12 systems, you know, is your circulatory system, there's your nervous system, there's your respiratory system, there's your reproductive system. I could go down. Your skin is a system, but your immune system is a very special system. Boy, without the immune system, well, without any of the systems, you need all of them. You really need all of them. But your immune system is really a complex network of tubes, organs, special cells, special protein there in your body laid out that defends your body against external infections and also protects your body from damage. And the immune system, let me tell you that, keeps a record of every germ, every microbe. I'm talking about every bacteria, virus, fungus that I've ever come across. Because, you know, there are different viruses and fungus in different parts of the world, in different parts of the country. You know, up in the mountains, there are different viruses and germs to people down in urban areas, you know, and your immune system keeps a record, a catalog of the exposure to these germs. And guess what? If you are ever exposed to these germs a second and a third time and so, your immune system acts. Your immune system activates and turn this off and stops the whole process. It is amazing. Yes, the immune system activates and stops the whole process so that you will not have a severe infection. If you've never been exposed to these germs before, well, you will now go through the full course and a high risk of catching disease. But if you've been exposed to it before, your immune system It's like a stitch in time saves nine. It's able to know how to tackle. It knows how to hold on to the germ and wrestle it to its knees and kill it before it has caused a big problem. So now, I want you to understand there can be abnormalities of your immune system. Sometimes you can develop what's called allergic diseases. Okay, you can deal with allergies. This is where your immune system has an exaggerated response. An exaggerated response. In other words, it's supposed to kill the fly with a slap. It's supposed to kill the germ with a slap. But if it has an exaggerated response where it uses a sledgehammer and smashes, it's an exaggerated response. On the other hand, your immune system can be deficient, immunodeficiencies, so that you can have poor responses. Oh gosh, I gotta. This is unusual. Sorry, I'm on radio, but I'm gonna call you back. That's the only way I could. I don't know why I didn't put it on. Is that a first for that? Yeah, as a first. Sorry. Oh, well, then, besides your immune system being deficient or not giving you a sufficient response, you could also have what's called an autoimmune reaction, an autoimmune disease, where your immune system isn't just, let's say, overreacting, or your immune system isn't underreacting. Your immune system has turned on you and starts to attack your body cells. So all these things are diseases of the immune system where you can have an allergic reaction, or you can have immunodeficiency. AIDS is where the virus has caused your immune system to become deficient. It's not going to respond to infection. It's not going to be enough. Or you can have certain diseases like arthritis conditions, certain other conditions, lupus, in which the immune system isn't just overreacting, it starts to attack you. So I wanted to explain that. So immune system and germs, I tell you, that's what the main thing we want to stop. We want to stop germs. And germs are always around us. Germs are in the air. As I breathe in there, do you know there are germs floating and so forth in the air? On the surface, there's germs. On the surface of this container, there are germs. The germs in my mouth, the germs, all over the place. But your immune system, as I say, keeps a record of the germs you've been exposed to from since you were a child. And it stores that information in some special white blood cells in your blood and in your tissues in your immune system. We call them lymphocytes. There are two types, there are many different types, but there's B lymphocytes and T lymphocytes. B and T, the thing is that I want you to know that there are these special white blood cells that store the information. And if a germ comes along, it's almost like a burglar alarm. If a virus comes along and your body your T cells remember it, then guess what? Your body produces more white blood cells and substances to hold on to that virus and deal with it. It's such a wonderful system, that immune system, when it works properly, when it works wonderfully. If the germ is new, if the germ is a new germ and your body's never seen it before, then your body sometimes doesn't know how to respond, or the response is slow. You know, imagine a burglar or gunman breaking into your house, a home invasion, and they're able to do whatever they want to, and so. But if you were prepared, well, something different. You know, that's the point I'm trying to make, Kamal. You know, now some infections, though, like the flu or the common cold, well, guess what? They act sometimes as if they're a brand new infection. And the reason for this is that the flu and the common cold viruses, which are different, are caused by many, 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 many different types of viruses, or by one virus that's changing the strain very rapidly. We get about 2 or 3 waves of the flu virus every year. And these different strains are very different from each other. Some may originate out of birds, some may originate out of swine, some may originate out of different things. But if your body has not been exposed to this before, then it's going to come as if it's a brand new infection, and your body has to learn, your immune system has to learn how to fight off this infection. But if you had been exposed to it before, like measles or mumps, and you basically immune to those things, then your body says, I know how to deal with you. And they're able to tackle those viruses very early and prevent those viruses from causing bad outcomes and risk of death. So that's the way we sometimes worry about the colds and so forth. So let's go to how your immune system is made up. The main part of your immune system I was just talking about are your white blood cells. White blood cells that are in your lymphatic system, that's your immune system, in your blood system, in your tissue, these white blood cells. Then you must have heard about antibodies. Some of these white blood cells release antibodies. These are like machine guns. These are like handcuffs and machine guns where they could hold on to the virus and literally beat it like Pac-Man or target practice on dealing. But once they're able to hold on to it, then there is tubes that go right around your body. Everybody knows you sometimes have lymph nodes. Does everybody know you have lymph nodes? And all these lymph nodes are connected by tubes. You sometimes feel lymph nodes in your groin. You sometimes feel them underneath your armpit. You sometimes feel them in your neck. There's some behind your jaw hair. There's some right at the back behind your ears and so forth. We call these lymph glands special names based on their location, but they're connected by tubes, and these are called lymphatic system. But you know what? There are literally like some big organs. Have you heard of the spleen? Kamal, have you heard of the spleen? Well, the spleen is right underneath your left rib cage. Your spleen is a very special organ. And blood flows through your spleen. And your spleen is like a filter. You know, in a car, you have a gas filter and an air filter, oil filter. Well, why you consider the spleen to be like an air filter, gas filter, or oil filter all in one? And it filters your blood. But guess what? Anytime it detects germs, it says, you're not supposed to be there. And it starts to produce an immune system. But it produces the immune system not in a crazy way, in a controlled way, and helps to protect you. And it produces some very special white blood cells. We call them killer cells. We call them killer cells because as the blood passes through, they're waiting for no immune system to mount up. So inside your spleen, you are also producing killer cells that's able to deal with germs straight away, although you will see other things. Then there's the bone marrow. Do you know your blood is mainly produced in your bone marrow? For sure. And white blood cells, red, all of them are produced in your bone marrow. Bone marrow is very important. And then there's a gland I want to tell you about called the thymus gland. And many of you have never heard of that before. It's a gland. This is my breastbone right behind it, right in my neck, coming down behind, not in front, behind this sternum, behind this breastplate is the thymus. It's usually big in children. Gets very thin as one gets older. Some actually disappears, but it's producing some special white blood cells called T cells. These are the ones that produce a lot of memory and so forth. So all that is your immune system, and it functions in a, let me just go through. White blood cells are really important. And as I said, they could be produced in your bone marrow. Some of them produce in your spleen. Some of them produce in your thymus. Your bone marrow is the main place. And these white blood cells, consider them to be the army of your body. And consider them to be able to attack germs. Now, I want you to also consider T cells. The T cells that are white blood cells, I want you to consider them to be like generals. And they're able to tell the army, go here, go there, fight this, fight that. But they're the ones that will be able to detect if the germ is present. So you don't want the T cell saying, go and attack your heart or go and attack your bone. You understand? Because that would be an autoimmune. That would be turning on to yourself. And you don't want the T cells to make your immune system overreact, like with asthma or with allergic reactions. You want the T cells to be nice and calm generals who know their job and can direct things properly. And so there's also cancer cells. You know, cancer cells are always being produced in your body. Your immune system doesn't just fight infection. Your immune system fights these new cancer cells that develop. If your immune system is strong, vibrant, it's able to nip the cancer cells in the body and destroy them before they start to multiply and grow and get bigger and bigger, and then nobody can handle them, you know? So your immune system is very important. White blood cells are very important. Many white blood cells, certain type, produce antibodies, right? They produce antibodies that could go, and when they reach, the way they kill a germ is that some white blood cells are able to suck in the germ. But you know, other white blood cells, they release these antibodies that actually act like a handcuff. They hold on to the germ. And by holding on to the germ can't move. And therefore, they're now able to deal with it. And other white blood cells could come, the ones that suck in the germ and deal with it. This is what's going on inside your body all the time on a daily basis. Well, there's some other things that are produced in your body. And let me tell you about them. I was telling you about the lymphatic system. Imagine, you know, you have blood vessels. You could see blood vessels all around on your arm, your neck. You see those blood vessels, veins and arteries. We see those. You don't see the other channels, right, of the lymphatic system. They're much smaller, they're flatter, and they essentially are very, very important. That's where a lot of your fluid is. That's where a lot of the white blood cells lie. I'm trying to explain. And I've mentioned to you about the spleen, you know, and for some people, they have to have their spleen removed. So what you understand, if somebody has had this, you could get into like a car accident. Suppose you get into a car accident or somebody punch you in your stomach, it could rupture your spleen. The surgeons will go and take out your spleen. What do you think will happen to you after? You've lost that organ in your body that could filter the blood a little better, that could produce these killer cells. So you may suffer a few other type of problems by losing your spleen. Of course, your bone marrow and your thymus are very important. And these are your body defenses, your immune system. Really, really, but there's some other parts. Your skin is part of your defense. We have wonderful skin, and things can't get through our skin. You know, water falls on you, it runs off. Somebody, you get bruised, you might get a little bruise there and so forth. But, you know, your skin is tough. Your skin is a nice organ. It's waterproof. Nothing could really get in. And, you know, you're going, but then in your lungs, do you know your lungs, your nose produce a lot of mucus? That mucus, that snotty stuff, it's important. It helps to gather dust. It helps to prevent germs from just getting in. They have to pass through the mucus first, and the mucus will catch it, right? And of course, what we do, we swallow the mucus, don't we? We swallow the stuff. So it goes down the wrong way. But some of us, we spit it out. But you can't, in this world of modern, we don't spit. We don't spit out the mucus and so forth. That's not done. So I got to say, we got to swallow it. And it's okay to swallow it, you know? Then your digestive system. Now, I want to ask you, where in your body is most of your immune system concentrated? I wonder if anybody knows. Where in your body is most of your immune system concentrated? Is your head, your skin? Where is it? Well, guess what? It is in your intestines. Your intestines accounts for some 70 to 80% of your immune system. Why? Because that is the greatest area that germs can get in. And what you thinking? Your number two, the bulk of your number two is bacteria. You don't want that bacteria getting into other parts of your body. And so your intestine is fortified, and around the walls of your intestine, it's huge amount of immune cells. Immune cells that's there. Any germ that tries to get in, stay in your lane. Stay inside this tube in your intestine. Do your job inside the intestine. And the bacteria do a good job whilst they stay inside the intestine. That's why, you know, if somebody, I gotta say this, if somebody gets stabbed or their belly punctured and it goes through one of the intestine and some of the stool leaks out into the belly, boy, that's a hard infection to treat, because the amount of germs that leak out, there's type A, B, C, D, E, F, G, H, all kind of different bacteria. And unless you're giving some good antibiotics, unless some of the surgeon goes in and washes out the intestine, those germs are going to grow inside there and cause an abscess and cause problems and cause serious, serious problems. But luckily, we don't get stabbed. You know what I mean? I've never been stabbed. And Kamal's never been stabbed. But that means my germs are staying inside my intestine. But the reason why they're able to stay in is because my immune system, 70% of my immune system is dedicated to keeping the germs inside the intestines, inside your intestines. You might find that strange. You may have thought that most of your immune system is in your skin, or most of it is in your lungs, or most in your ears, or no. It's mainly in your intestine. So it's a very important function. Now, let's start with something, right? What happens if you are having a fever? Fever is really an immune system response. So a rise in your body temperature or fever may happen with some infections. Now, this is actually an immune response, and it is a good response, right? Because a rise in your body temperature, guess what? You have an egg and you try to boil an egg, you heat it, right? You don't put it in a bowl of water and leave it there. It'll get rotten. I mean, you boil it, you heat it. When your body's temperature goes up, germs don't like that. Germs don't like your body temperature go up. So when you have an infection and you have a fever, guess what? That's good. Your body and your immune system is trying to kill the germ, first of all, with temperature. That's the first thing. First thing you notice, fever. You may notice a bit of pain and so, but fever is the first thing, even before the pain. We see a temperature in a baby and in an adult. We see your temperature rise. And I'm saying that temperature rise is a good thing because it's trying to fry the germ. It's trying to boil the germ. It's trying to roast the germ. You understand? It's trying to barbecue the germ. And it usually is successful at doing that. You know? Now, the fever triggers some other body responses. Now, truthfully, sometimes that virus or that germ is smart and it knows you're going to have a fever and it knows you're going to throw a fever at it first. You understand? And it has ways of still surviving the fever. So, you know, other things have to help out your immune system creating a fever. Fever can't be the only thing. Fever is the first thing, but fever can't be the only thing, right? So in terms of what we then see is the white blood cells with antibodies, especially if they've seen this germ before, attacking, taking over, and dealing with this germ, dealing with it properly, you know, and precisely, you know, and then the fever goes away too. There's no need for any more fever. Your immune system could do without that. Now, I want to say some of the common disorders of the immune system before we go on the break, right? It's common for people to have this overreaction to immune system, such that suppose you take a medicine like penicillin and you're allergic to it. Well, boy, you're gonna have fever, you're gonna have bad feelings, you're gonna have a rash, you're gonna have all kind of. Sometimes this happens because you're allergic to some food, whether it's nuts or shrimp, and again, it causes a rash, it could cause swelling. The immune system is one in which it does a whole set of things. Besides fever, it starts to create redness. It starts to cause swelling, and the swelling could sometimes cause pain. So all these things are experienced. Now, when somebody is exposed to pollen, grass, it could trigger not only that type of immunity, but it could also trigger the lungs to behave funny. And that's how people develop asthma, right? It causes the airways to become tighter and persons can't breathe. You know, if you get stung by a bee or you touch some stinging nettle, all these things trigger your immune system and you're able to get a rash, a swelling, and so. And remember, I've mentioned to you about autoimmune diseases. Those things I've mentioned to you about as swelling, but autoimmune disease, like with lupus, even type 1 diabetes, arthritis, your immune system starts to attack you. Let's say start to attack your joint, the joints of your fingers, the joints of your knees. It may start to attack your skin or certain parts of your body, as in lupus. And these are not good. In arthritis, it starts to affect your knee. You know, your own immune system begins to attack your knee. That's something what's happening with arthritis. And it's an autoimmune type condition. And we could go on talking about that. Let's take the break. We come back and we'll talk a little more about it, and then we'll open up the lines.
People's Pharmacy for all your pharmaceutical, skin, and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
Yes. Now, I just mentioned to you about arthritis being an autoimmune disease. Well, there's several types of arthritis. There's an arthritis called osteoarthritis. This is somebody who's been working hard all their life on a farm, lifting things up, bending their bones and jumping, or a sports person. You know, there's American football players and getting hit and beaten and so forth. Well, the wear and tear on the bones could cause osteoarthritis. But rheumatoid arthritis is an autoimmune disease by and large. And it starts to sometimes affect your fingers. Sometimes your fingers start getting distorted and swollen. It sometimes affects your wrist. It usually affects your knees and your ankles. There are other type of arthritis that start to affect your back. And a lot of these conditions, they are related to each other. I could start giving you the whole names of many different type of arthritis we call autoimmune diseases, where your body's immune system
something like that. It could do many of those things depending on the virus. With COVID and certain other conditions, guess what? It throws everything: mud, sticks, stones, arrows, bows. It throws so much of the power of the immune system at the virus. A smaller thing would have killed the virus. But it shows all these sort of things, that those other things start to affect other tissue of the body. It isn't a true autoimmune disease, but it is so overwhelming. It's such an overreaction. It's such a super overreaction. When the COVID virus gets into your system, your body, some people respond so violently, so aggressively, the immune system responds so aggressively that it could make them sick, very sick. And that is what was taking place. Now, everyone should know that in general, it's good to have a healthy immune system. And maybe another program, we could get into what can boost and make there to be a healthy immune system. But let me first of all say fruits, especially fruits with vitamin C in it. And you know, in the Caribbean, we have this West Indian cherry. I got a nice tree in my yard. I've planted a few of those trees out at the mangrove. And those West Indian cherries have a high content of vitamin C. Superb for the boosted immune systems. Vitamin C and fruits. Fruits are excellent. Then vegetables, right? Vegetables, bell peppers, and those sort of things. Kale, they are excellent. Then in terms of nuts and seeds, these contain a variety of things. They contain zinc, copper, iron, selenium, as well as a number of vitamins. Zinc is important in terms of boosting the immune system. And then let me talk about protein. It's good to have healthy protein in your diet. Vegetable protein, animal protein, doesn't matter. You know, protein. If you're being starved, come on, if you're going through starvation, you're not getting enough protein, guess how we make your immune system cells? We need protein. You need not sugar, not fat. You need protein to make good white blood cells, to make good antibodies. You need protein. Vegetable protein as well as animal protein, the good type. And luckily enough, you'll find that by having good white blood cells, it means your immune system is strong. So eating protein. And herbs and spices. I want to identify two special herbs and spices. Garlic. Whenever you hear garlic, think immunity. Garlic, immune system. Garlic, immune system. Garlic, immune system. Garlic is a big immune booster. And you basically utilize garlic in your food and so forth, it is going to have a very, very positive effect on your immune system. And then turmeric. Turmeric has a substance called curcumin. Let me say that again. Curcumin. And boy, this stuff is so good. The process to have it in tablets, but I don't see why you have to take a supplemental tablet. Why you cook with we got fresh turmeric here, say Vincent, right? Cook with it, you know, cook with it. Some people say cooking with it is not as available as if you take a tablet. Why take a tablet and pay $30, $40 for a tablet when you can get some nice, curcumin and so forth, and inside the turmeric itself, and that turmeric is a very good immune booster. It helps to cut down inflammation. It's an anti-inflammatory medication type of herb. Turmeric is excellent. Green tea. A number of these type of things that are very, 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 very good. So just recapping. In your body, most of your immune system is concentrated around your intestine. Your immune system is so vital On one hand, you don't want your immune system overreacting, right? You don't want your immune system overreacting. You don't want it to develop allergic reactions. Allergic reaction, and if you do know you have an allergy, don't get exposed to those things. If you're allergic to penicillin, if you're allergic to aspirin, if you're allergic to bee stings and so, be careful. Then you don't want to be immunodeficient. You don't want your immune system to be sluggish. Boost it. Even if you have HIV disease or some other type of thing, it can still be boosted, And then you don't want an autoimmune disease. You don't want your immune system to come and attack you back. All these things are not good. Now, I've covered a lot of different areas this evening, and some of it, many of you may find it a little bit complicated and so, but I've tried to simplify it in a particular way that your immune system is really, really important, and it needs good health. Remember, we are 864579997. I don't think we've received any text of yet.
We just had a little glitch.
Yeah.
Right. So well, the phone lines are back up. WhatsApp should be there shortly because
Okay.
somebody
We've been out.
on just a couple of seconds.
Yeah, a couple of I saw that.
Yeah. Right. So somebody on on stream on Facebook was asking if the WhatsApp not working.
Mm-hmm.
So we'll attend to that shortly. But I don't want to ask a question, right?
Yeah.
As good as our immune system is, what's the deal with let's say infection like AIDS? Why isn't it capable of dealing with it? Why is it?
Yeah. Well, that's a great question. I touched on it, but remember I said the main part of your immune system is your white blood cells. I said your immune system is made up of the tubes, made up of your bone marrow, your spleen, your thymus behind your chest hair, thymus gland just behind. I could put my finger down and touch the top of my thymus. Is that? And my just underneath my ribs here, I'm feeling my spleen, But your white blood cells are scattered all over your body is the most important thing. Now, guess what? Your thymus gland produces most of your T cells. Your bone marrow also produces T cells. And your T cells are your generals. Let me say your white blood cells, you have the army, you have other cells that are like captains, you have other cells that are sergeants, some that are lieutenants, some that are majors, and some that are generals. Your T cells are your generals. The HIV virus is smart. It ain't attacking the army, the foot soldiers. It ain't affecting the captains. It ain't affecting the sergeants and the lieutenants. It's going straight after the generals. And the generals, the T cells, are the ones that help to control the army, and tell the army what to do, to go here, to go there, to control it. Without the generals, so what happens? The virus gets into the T cells and infects the T cells. The virus multiplies inside the T cells, gets released to infect more T cells. And that T cell that's infected eventually dies. So your amount of T cells, we're able to do blood tests to check the amount of your T cells. And we can find your T cells are down. We find your T cells are down. When your generals are not around, but when the cat's away, the mice will play. So that HIV disease is a process where the virus has selectively attacked a strategic powerhouse in your immune system, the T white blood cells, right? And so as a result, it is your immune system is like not under control. Your immune system is sluggish. Your immune system can't function. And so if now another germ comes around, right? It could affect. But more importantly, with HIV, because your immune system goes down, guess what? The germs in your intestine, the germs in your skin, the germs under your nails, the germs in different parts of your body that's lying there, that's been kept at bay. Okay, we know you're there. We know you're there. Guess what? I say when the cat's away, the mice will play. They start to invade your body and cause a problem.
I was just trying to think of a way to ask the question, right? Now, your white blood cells are produced by a bone marrow. And just like the HIV virus that affects the T cells, are there other diseases that affect? What are some of the other diseases that affect your immune system?
Oh,
And
yes.
that could be one. I probably think about the other.
Yes. Well, listen, remember I was saying that white blood cells are mainly produced in your bone marrow, but they could be produced in your thymus and also in your spleen. The spleen produces these killer cells that could kill the germ quickly. The thymus produces a lot of the T cells, the generals. The bone marrow produces a lot of the troops and the captains but could produce some generals too. Now, let me say, there are many diseases that can affect the bone marrow, right? There can be cancer. Let me give you an example. Sickle cell disease is a disease of the blood, and your spleen could start getting clots in it. There are different other viruses, I could tell you, that are notorious of trying to get around the immune system. Let me give you an example. Tuberculosis, TB. TB knows how to evade the immune system. Can I tell you, syphilis is also a great masquerader, also knows how to immune. So majority of germs, your immune system can handle them with ease. But there are some of these germs that have learned how to beat the system, how to get around this, how to get around that. And they can avoid your immune system. Some germs, guess what they do? They get into a white blood cell, but the white blood cell doesn't kill them. You understand? It gets into a white blood cell, but the white blood cell doesn't kill them. And so they're able to float around. And when they reach a certain part of the body, then they jump out. You understand? There are thousands of different germs, and they behave in different ways. Some are very crafty, smart. Others are just rough and tough, and we could deal with them. You understand? They multiply fast, but that doesn't matter. We can still catch it. We round them up and deal with them, squash them. But others, they know how to tackle. They know how to bob and weave, And so, yes.
I'm sure there are other like viruses where the body would attack and pretty much keep them at bay, not get rid of them.
Well, you know something? I'll tell you. Consider chicken pox. If you get chicken pox, your body will deal with it. But often the chicken pox doesn't go away.
And when we say the body, we're referring to the immune system.
The immune system deals with it. It deals with the immediate effect. But when you think the virus has gone away, the virus starts to hide. In the case of chickenpox, it starts to hide in your spine. It hides in certain parts of your spine. It's not going to cause any problem, but 20, 30, 40 years later, 20, 40 years later, it could come back out and you start getting what's called shingles. Have you heard of shingles?
Yes.
And it now it runs down the nerve and comes out on your skin. I got to say this very carefully. Sometimes when somebody has shingles, it suggests that the immune system is not functioning well. It sometimes is an indication that they may have a cancer brewing. And there is somebody who developed shingles. I as a doctor would always do a quick workup on them to make sure they don't also have some form of cancer in this early stage that's affecting the immune system, suppressing the immune system too, and has given the chickenpox virus the impression that, hey, the cat's away, the mice could play, let me play, and the chickenpox comes out as shingles, right? Because the immune system isn't functioning properly. Again, I'll go back. Tuberculosis is also notorious for this. Sometimes the people who have been exposed to TB, but the TB is walled off, you know, and it is. I got to tell you once again about syphilis. If syphilis, when it comes out, it causes a rash in the private areas. Then it goes away. The immune system helps it to go away, but it hasn't gone away. The germ could come back out as a generalized rash in the skin. Then it can go away again. And it could come and start to affect certain parts of the heart. And then after about 20, 30 years of the syphilis being inside your body, it could start getting into your nervous system, your brain, your spine, and start affecting the way you walk and the way in which you speak, your memory, and all those sort of things. So the immune system is not always 100%. Now, if somebody's drinking a whole ton of rum, right? If somebody is also on steroids, right? And steroids for a long time, or diseases in which they have an overproduction of steroids in their body steroids, certain hormones. These things could also affect the immune system in a major way, you know? So, we have a question. Good night, doctor. I always listen to your program. Where's your office? Where is your office located? I didn't come and have a chat with you. Oh my dear. Well, I should have read this before I said it, but I don't actually have an office anymore. I'm not actually practicing full time and so forth in terms of an office. I'm sorry about that. But there are lots of other great doctors around in St. Vincent de Grenadines. Don't say other. There are lots of great doctors. No, I shouldn't say other. I mean, I'm not a great doctor. There are lots of good doctors around in St. Vincent de Grenadines. And I would like to invite you to see one of them, who to be able to, I'm sure, answer some of your questions. But, if anytime you may have a question, I think next week what I would do, I'll put back up on my email, my special email for this program, so that in case you do have a question and you don't want to ask the question on air, you don't want it read, you could always text me, and I'll try and respond to you in a private way and guide you in the right direction in terms of where to go. I think that's the best answer, to give you. So, Kamal, this evening we'll be talking about the immune system, and it's a fascinating area. I'm an infectious disease specialist. I'm an immunologist too, and I haven't really done a lot of practice with immunology because it's a bit of a boring subject. I can tell you that. You know what I mean?
From a doctor's perspective.
From a doctor's perspective. But a lot of people don't realize that they have problems with their immune system. Whether you have allergic reaction, whether you have conditions in which your immune system is not functioning properly, whether you have autoimmune diseases, the lupuses, right? Or you have the arthritis. I mean, there's so many different types of arthritis. And guess what? They've realized too that type 1 diabetes is an autoimmune disease. There are antibodies that are attacking the pancreas, antibodies which have attacked or attacking the pancreas and attack the cells that produce insulin, so that somebody who's producing an adequate amount of insulin over a short period of time, over a long period of time, the insulin producing cells in the pancreas get destroyed by this autoimmune disease. And as a result, they could no longer produce insulin. And they have to take insulin as an injection in some form in order to satisfy their body needs and control their blood sugar. Type 1 diabetes, right? We're now seeing an increasing amount of people with type 2 diabetes who also have some autoimmune component to it, right? Things that are attacking their pancreas and helping to throw things off. But, you know, autoimmune disease and all these other conditions I've mentioned to you, you should, if you do suspect that you may have one of these things, please do see your doctor. Ladies and gentlemen, it's always a pleasure. And once again, I apologize just because I was up there with Marley and ackee and saltfish and jerk chicken. And so I don't want anybody to think that there was a dereliction of duty why I didn't come on last week. But I was enjoying myself in Jamaica and some important things. I had a good time. Thank you very much, ladies and gentlemen. I want to bid you a very pleasant good evening and good night.
People's Pharmacy for all your pharmaceutical and body care needs. Located